Doctors, what was the craziest self-diagnosis a patient was correct about? Let's find out. Story 1. I realized my partner probably had leukemia nearly a week before I finally persuaded him to see a doctor. He had been bruising unusually, bleeding easily, and had visible petechiae. I suggested going to urgent care, where I knew they could run a CBC test quickly, but he insisted on seeing his primary care provider instead. I took him to the appointment, having already packed a hospital bag and stashed it in the trunk. I told him it could just be a B12 deficiency, but that doing blood work would ease my worries. I asked whether the CBC would be processed on-site, and his doctor said it was sent out. I asked if it would be expedited, and he got upset, saying, "There's nothing a CBC would show that would change my treatment." Then he told my partner to stop me from looking things up online. That night, the lab called. His white blood cells were critically high, platelets dangerously low. I rushed him to the ER. He was diagnosed with acute leukemia. Story 2. One of my closest friends from junior high went through a nightmare with her health. She was bright and thriving in university before her health collapsed. She had to drop out just before graduating. She lost a high-paying job, and basically her whole life unraveled. She told me about an odd anemia caused by extremely low ferritin levels, which helps red blood cells carry iron. That's when it clicked. Severe digestive issues, unusual anemia, recurring spleen infections that led to removal, allergic to sulfa drugs, severe reactions to carbamazepine, retinol caused a peeling rash. I dropped out of pre-med, but in one class we'd learned about inherited conditions like porphyria. I remembered one test: have someone urinate into a clear plastic cup and leave it in direct sunlight. The urine changes to wine red or purple if they have porphyria. I asked her to try it. A few hours later, she called me screaming. The urine had turned a vivid purple red. I told her to get tested. 2 weeks later, she tagged me online as lesbian Dr. House when she was officially diagnosed. Story 3. Emergency physician here, with more than a decade of experience. While not a formal diagnosis, I've learned to treat it seriously when a patient says they think they're going to die, even if they seem stable at the time. Patients with life-threatening conditions often get a deep sense of their impending collapse. Sometimes it's from subtle clinical signs most people wouldn't pick up on. I've seen patients who looked perfectly stable, like a motorcycle crash victim with a single limb injury, mention feeling like they were dying, only to suddenly code from an unseen arrhythmia. There's a belief that patients might detect a sudden drop in blood pressure or a flood of stress hormones that precedes death. The science isn't solid on why this happens. Some of these patients survive, others don't. But whenever someone looks me in the eye and says, "I feel like I'm going to die," I listen because far too often they're right. Story 4. I'm not a medical professional, but here's what happened when my son figured out his own diagnosis. A few years ago, he got a horrible earache and went to urgent care. They told him it was a bacterial ear infection and prescribed antibiotics. The pain got worse, so he went back and was told to make an ENT appointment. But it was a weekend, and none were open until Monday. Meanwhile, his ears started draining, and he noticed what looked like fungal spores. He's a naturalist and knows what spores look like. The pain became unbearable, and he went to the ER. He told the doctor he suspected a fungal infection. Later, he overheard the doctor laughing in the hallway about his spore comment. He was prescribed more antibiotics and a steroid. He flew home for Thanksgiving. Once here, he collapsed in pain. I called every ENT in town until one squeezed him in. The PA confirmed a fungal infection. The steroid he was given had actually worsened it. She prescribed the right treatment, and he recovered quickly. Story 5. Patient here. I had a workplace accident while opening the roll-up door on my delivery truck. A load of tires fell, hitting my shoulder and neck. Days later, I started fainting. My arm was swollen and discolored, and I had constant pain. After seeing multiple doctors and specialists with no diagnosis, I figured it out myself. I'd torn the anterior scalene muscle. As it healed, it pinched the subclavian artery and nerve to my arm. Due to my anatomy, the compression occurred between where the carotid and vertebral arteries branch. The carotid still fed my brain, but blood to the vertebral was blocked, so my body reversed the flow, pulling blood from the circle of Willis, vessels in the brain. That was how my arm got blood for months. A Doppler ultrasound confirmed thoracic outlet syndrome with subclavian steel, retrograde blood flow in the vertebral artery. It made sense. All the odd symptoms finally added up. Story 6. I was through hiking the Appalachian Trail near Roanoke, Virginia. All was well until I noticed I was peeing blood in my motel room. I'd also developed odd sores on my legs that stopped at the ankles and thighs. I went to the ER. 3 doctors all insisted it was a tick-borne illness, probably Rocky Mountain spotted fever. But I'd had that before and knew it wasn't the same. The 4th doctor came in, and I told her I thought I had Henoch-Schönlein purpura, a rare autoimmune issue in adults. She agreed it was worth checking and sent me to Virginia Tech for a biopsy. It came back as vasculitis. Later, I developed joint pain and abdominal symptoms. An ultrasound showed I had underlying polycystic kidney disease, genetic, but not inherited from my parents. Doctors began treating me like a medical curiosity. Years later, I'm on mild blood pressure meds and symptom-free, but for a while there, it felt like I was living on the set of House. Story 7. Patient here. My story is long and frustrating. I started getting migraines more frequently, then nosebleeds and fainting. One day, a migraine hit and never left. My doctor gave me a Toradol shot, which didn't help, and sent me to the ER. They said it was sinusitis and told me to get a humidifier. Nothing changed. I began hearing my heartbeat and saw an ENT who ordered an MRI. The results made them refer me to neurology ASAP. I called 13 offices before getting an appointment. The MRI showed possible high cerebrospinal fluid pressure, but they needed a lumbar puncture to confirm. My pressure was 40, it should have been 15. The meds didn't help, and the neuro was a sleep specialist. I switched to a headache specialist, tried different meds, asked if my IUD could be a trigger. He said no. I removed it anyway and my pain dropped significantly. I reread my reports and found I had a collapsed sinus vein. I pushed for a stent, finally got surgery, and the pressure was still 40. I was right all along. Story 8. Patient again. My case wasn't crazy to me, but my doctor thought otherwise. My mom has ankylosing spondylitis, as did my great-grandfather. I tested positive for HLA, B27 as a toddler. By 19, I started having joint pain in the same areas as my mom. I went to an orthopedist nearby and told him all this. He flat out told me there was no such gene, and my joint was just stiff. He suggested a painful shot I refused. I waited it out and saw a rheumatologist instead, longer drive, longer wait, but worth it. Sure enough, the rheumatologist confirmed I had ankylosing spondylitis. I had literally explained everything to the first doctor, who dismissed me. If he'd just listened, I could have started treatment much sooner. Story 9. As a patient, I've always felt something was off with my heart. As a kid and teen, I wasn't taken seriously. Doctors would listen for a second and say I was fine. Eventually I ignored it. After a few health scares in my 20s, I felt my heart getting worse. I fought to get a cardiology referral. The cardiologist told me to track my vitals and come back. Then COVID hit, and everything shut down. The only major event was a hospital visit for dehydration, where a teaching doctor used me to demonstrate what an S3 heartbeat sounds like. I got a portable ECG monitor and learned to read it myself. I went back to the cardiologist and told him I believed I had WPW syndrome. He scoffed until I showed him my data. He ordered tests, and sure enough, I was right. After a catheter ablation, my life improved. If I'd been taken seriously earlier, meds might have been enough. I never should have had to teach myself how to read ECGs. Story 10. I've been a patient 4 times in my story. First was at 15, severe abdominal pain and irregular periods. Doctors brushed it off as anxiety or period-related. I eventually collapsed at Comic-Con, went home, and woke up in agony. ER said constipation. My mom demanded a second opinion. I was admitted, went gray, barely responsive. A scan showed ovarian torsion from a massive growth. I almost died. Second time, at university, I collapsed from kidney pain. I suspected stones, doctors laughed. CT showed a stone. Third, horrible lower right pain, told it wasn't appendicitis because my labs were normal. Discharged. Later that night, vomiting uncontrollably, ambulance ride. Finally a doctor actually palpated my abdomen. It was appendicitis. It burst during surgery. Fourth time, persistent reflux and pain. GP didn't take me seriously. I asked about a hiatal hernia. He rolled his eyes but referred me. Turns out I had a rare type of hernia with the stomach pushing into the esophagus. Every time, I knew something was wrong. Doctors didn't listen. Story 11. Patient here. I also work in healthcare. It started with pain deep in my right leg, specifically near the glut. It got worse, shooting lightning like pain down my leg, plus tingling in pins and needles. I thought maybe a mass or fluid buildup was pressing on my sciatic nerve. After a week of increasing pain and starting to feel septic, I went to the ER. They dismissed me and sent me upstairs to the main ward, who immediately bounced me back to the ER for imaging. A CT revealed a 500 milliliters abscess under my muscle, compressing nerves in my leg. Before the second surgery, my specialist doubted they had drained that much fluid. I had to show him the photo evidence. He literally said, "If we'd removed that much, you'd be in the Guinness Book of Records." Afterward, he brought in multiple nurses and doctors to review the case. Pretty wild, considering I almost didn't get scanned at all. Story 12. Saw a patient for an initial visit, a 52-year-old man originally from Brazil. His nephew, already my patient, brought him in. This man had curled fingers and toes, reduced sensation, and skin lesions with signs of tissue breakdown. He said his mobility had worsened over the past 6 months, and that he hadn't had medical care in a long time. To me, it looked like a vascular issue. I said I'd run some labs, but wanted to refer him urgently to a vascular specialist. Then he said he thought it might be leprosy. I dismissed it at first and pulled up images to show him how rare it was, until I saw photos of mild cases that looked just like his. I told him I'd also refer him to dermatology just in case. A couple weeks later, the biopsy came back, leprosy. In over a decade of practice, this was one of the rarest diagnoses I'd seen. It taught me never to assume unlikely means impossible. Story 13. Not a doctor, just a patient. I'd had chest pain and trouble breathing for a week, so I finally went to the ER. It took over 10 hours for basic labs, and I was told to rest for a few days. I returned 4 more times as my condition got worse. I could barely get out of bed. I couldn't lie flat because I'd feel intense chest pressure. I saw my primary doctor and told him a friend of mine had similar symptoms before being diagnosed with pericarditis. He waved it off and referred me to a pulmonologist instead. After 7 months and pulling every string I could, I saw a cardiologist. He diagnosed me with, you guessed it, pericarditis. He started me on colchicine, which was the first real treatment. After 3 years of inflammation, my cardiac MRI confirmed both past and ongoing pericarditis. I'm now awaiting a rheumatology referral. I still wonder if it would have become chronic if I'd been diagnosed properly from the start. Story 14. I'm a nurse now, but this happened when I was a teenager. I used to have what felt like constant déjà vu, sometimes accompanied by nausea, flushed skin, tingling hands, and brain fog. These episodes would last 10 to 30 seconds and leave me wiped out. I'd search my symptoms online and always landed on epilepsy, but I brushed it off. I thought seizures meant falling down and shaking. Years later, as a nurse, I learned about focal seizures and realized my experiences matched them. I suspected I had temporal lobe epilepsy triggered by hormonal changes, since it started with my first period. I put off seeing a neurologist because the symptoms were internal and subtle. No one else ever noticed. Then, while working a hospital shift, I had a stronger episode. I tried to sit, but instead collapsed in a patient's room and had a full-blown seizure. I woke up confused, bleeding from my tongue, with shoes flung across the room. Neurology confirmed I had catamenial epilepsy with partial temporal lobe seizures. I'm now seizure-free on medication. Story 15. This happened a few years back. I was at a conference 8 hours from home when I started feeling fluish, fever, muscle aches, extreme fatigue. It was June, not flu season. A walk-in doctor gave me a Z-Pack. I kept getting worse, so we drove home. My spouse, a doctor, rushed me straight to the ER. I was ghost pale, blood pressure in the 70s, kidneys starting to fail. CT scan showed nothing. They suspected E. coli, but that didn't match. I was admitted on 4 antibiotics. Still got worse, so they moved me to ICU. After 5 days, I finally went home. At the time, I was still undiagnosed. My spouse, who's board certified in dermatology and internal medicine, pulled my labs and contacted the state health department. They tested my blood in both acute and recovery stages. Turned out it was Rocky Mountain spotted fever. I'd been given doxycycline, which fortunately treats it. No tick bite found, no rash, no woods hiking. Still, that was the sickest I've ever been. I hate ticks with a passion now. Story 16. As a provider, I've seen a shift. Increased workload and instant patient access through messaging makes proper diagnosis harder. Patients often want new labs or treatments through a message instead of an actual visit. I always ask them to come in. It's surprising how often the wrong medication, is blamed for symptoms actually caused by something else. I do believe in patient intuition, though, even if I can't recall a perfect self-diagnosis off the top of my head. I always ask patients what they think is going on or what their goal is. Otherwise, we might go in completely different directions. Sometimes a patient returns and says something differently that changes my entire understanding. Maybe they used the right words that time, or maybe I had the brain space to catch it. I'm never mad when a specialist catches what I missed. I just care that the patient finally gets the answers they need. Story 17. I'm a medical physicist. One night I was out for drinks when a friend told me his buddy was struggling. He was sure something was wrong with his brain, but no one took him seriously. No scans, no referrals. Likely due to cost, doctors just gave him meds, which weren't working. My friend knew what I did and looked at me. I said, "I've got you. I work with research MRI scanners. We use healthy volunteers as controls." I gave him the sign-up link and said, "Have your friend fill it out. Mark his favorite food as warm ice cream, so I know it's him. If he gives any hint that he knows me, he'll be disqualified. We screen all MRIs and notify volunteers if something's off." A week later, one scan came back with something serious. I had no idea if it was him, privacy rules, but the next week my friend called. It was him. He had a brain mass and was scheduled for surgery within days. Sometimes bending the rules a little can save a life. Story 18. Patient here. During my senior year of high school, I got a tickle in my throat during my AP English exam. The next day, I had a fever, congestion, a cough, and was exhausted. Monday morning, the fever passed, but I had a sharp pain on my right side. My mom had booked a doctor's appointment, but our usual doctor was on maternity leave. The fill-in said it was probably an ovarian cyst, despite no prior issues. My mom thought it was appendicitis. The doctor said my white blood cell count was normal, so it couldn't be that. My mom called repeatedly until he finally ordered a CT, just to shut her up. It showed nothing, but he called the ER sarcastically and told her, "Maybe they'll give you the diagnosis you want." After 12 hours and an ultrasound at the Children's Hospital, they found an inflamed appendix leaking fluid. I had surgery 5 hours later. I'm grateful my mom didn't take no for an answer. Story 19. I have hypermobile Ehlers-Danlos syndrome, and it's caused endless health chaos. For years, doctors didn't believe me. Only in the past 5 years have I gotten proper diagnoses, but I had to figure them out myself and then find the right specialists. Every time I've suspected something, I've been correct, confirmed by tests and surgeries. I was right about EDS, POTS, MCOS, lipedema, endometriosis, adenomyosis, slipping rib syndrome, and now multiple vascular compressions. Today, I got a call confirming Eagle syndrome via CT. 2 of the wildest ones. My dislocating rib, it was slipping under the rib above it. My surgeon confirmed it instantly. No one believed that was even anatomically possible. The second was median arcuate ligament syndrome. I kept insisting I had it, even had imaging that showed compression. Eventually, a surgeon found my diaphragm was sitting too low and crushing my celiac artery and nerves. He operated, and now I have way less pain and better digestion. I've learned, be your own advocate or you'll get nowhere. Story 20. Patient here. This past year has been rough. One day, I woke up at my boyfriend's place and started having severe allergic reactions. At first, I thought I had a virus. I'd never had allergies before. But the reactions kept happening, random swelling, rashes, trouble breathing. I saw an allergist 2 weeks later and showed him photos and videos of my symptoms. He dismissed me. I had to ask 3 times just to get allergy testing. He claimed it was anxiety, refused to prescribe an epinephrine pen or inhaler. Instead, he sent me home with Benadryl. I left his office, and 3 hours later went into anaphylactic shock. I drove myself to the hospital and was admitted to ICU, needing multiple AP doses. I filed a complaint, but the allergist denied all responsibility. Since then, I've been hospitalized 4 times for anaphylaxis and was diagnosed with MCOS. I now have a great team managing it and started immunotherapy. Always trust your gut and never accept a doctor brushing you off. Story 21. I visited a walk-in clinic for a cough and mild fever. They told me it was just COVID and I'd recover fine. I didn't. A few days later, I went to my regular doctor and told him I felt like I had pneumonia. He dismissed it too, saying it was just a lingering cough. I explained that I'd had pneumonia before and recognized the signs. I also warned him that my asthma meds can mask how bad my lungs are. Still, he said to give it more time. I got much worse, coughing so violently I vomited, bruised a rib, and could only stomach Olive Garden chicken gnocchi soup. When I returned, the doctor again didn't hear anything in my lungs. I demanded a chest x-ray. He tried to talk me out of it, saying I'd be paying out of pocket, but I insisted. Turns out I did have pneumonia and needed a steroid shot, 2 antibiotics that wrecked my gut, and daily monitoring. The doctor later admitted I was right and fit me in daily, so I could avoid hospitalization. I even packed a bag just in case. Story 22. At age 6, I started having stabbing pain in my left flank between my back and side. My first back x-ray was done at age 7 in 1978 and showed nothing. My life was mostly normal, but the pain returned now and then. Doctors said it was just growing pains. When puberty hit, the pain worsened and would last for hours. I began vomiting during episodes. By age 15, the pain was weekly, and only one medication, Bupan, helped. A specialist asked to see me alone and accused me of making myself vomit. This was 1986 in Italy, and anorexia awareness was just beginning. I'd studied anatomy books and read the Bupan insert. I asked if it could be kidney-related. He laughed and said if it were my kidney, I'd be in agony, but he ordered an ultrasound. The tech laughed until he scanned me and went pale. My left kidney was massively swollen and necrotic from a malformed ureter. I had reconstructive surgery, a month-long hospital stay, and a nasty infection, but I survived. My instincts were right. Story 23. This happened a few years ago. I was pregnant with my first baby, and things were normal until I hit 36 weeks. I wasn't in pain, and my baby was moving fine, but I felt off. I couldn't explain it. I kept thinking about a Grey's Anatomy episode where a pregnant woman dies of preeclampsia. I Googled the symptoms, vision changes, swelling, headaches, pain, but had none of them. On the way to my OB checkup, I told my fiancé, "You're going to think I'm nuts, but I think I have preeclampsia." He thought I was just anxious, but I couldn't shake it. The nurse checked my vitals, my blood pressure was high. Then my urine showed lots of protein. I was sent to the hospital immediately for monitoring. A week later, I was induced due to preeclampsia. I still find it strange how I just knew. Intuition is weird. And real. Story 24. Patient here. I was told by a PA to just eat more fiber when I complained about pain. Turned out I had a 9 mm kidney stone blocking my kidney, which had swelled 3 times its normal size. I'd been in and out of urgent care for years with back pain. A urologist later looked at an old spine x-ray and said, "See that? That's the stone. It's been there for 4 years. At the start of COVID, I fractured my humerus in 2 places. Urgent care referred me to a specialist. The PA, thanks again, Kimberly, put me in a Sarmiento brace but didn't tell me not to remove it. I took it off in my sleep. I kept going to urgent care and even the ER, but no one helped. They said I'd need surgery anyway. I finally sat in the specialist's office and refused to leave unless I saw someone other than Kimberly. They booked surgery 18 days after the injury. The surgeon didn't allow the anesthesiologist to do a nerve block pre-op, so I woke up in screaming pain. He was furious, said, "This is why we do the block first." Story 25. I'm a male patient. One day after a shower, I felt a firm lump under my right nipple. It felt about the size and shape of a lima bean. I asked my girlfriend to check. She felt it too. I knew male breast cancer was rare, but it didn't sit right. I went to my family clinic and saw a young intern who looked skeptical when I told her. Then she examined me, felt it, and immediately changed tone. She booked me with an oncologist for the next day. The oncologist, a middle-aged man, skimmed her report, tossed it aside, and told me to remove my shirt. The second he touched the area, his eyes widened. He scheduled a biopsy on the spot. I'll never forget how stunned he looked, like, "How the hell did you notice this?" Luckily, it turned out benign. But both the GP and specialist were skeptical until they saw it themselves. Now I always push if I know something feels wrong. Story 26. Not a doctor, just a mom. My son was 7 at the time. He's tough and rarely complains. His school called saying he'd fallen from some new play equipment, about 6 feet, but he wasn't crying, so they didn't call an ambulance. I picked him up and could see in his pale face he was in serious pain. I brought him to the ER that Friday afternoon. Despite me telling the triage staff several times he had likely broken something, we waited for 3 hours. He just sat there quietly, barely moving. When we finally saw the doctor, she pressed on his arm, no big reaction, and told us it was fine. I pushed for an x-ray. She reluctantly ordered one. Half an hour later, she came back looking flustered. He'd broken both his wrist and elbow. She dismissed us because I was just a mom, and he wasn't crying. My kid was just too brave. I'm still mad about it. Story 27. My stepmom's an LPN, and basically diagnosed two of us in the family. After catching COVID in early 2020, my dad never fully recovered. He gained weight, started falling asleep mid-sentence, snored louder, had leg swelling, and constant anxiety. She suspected early heart failure from post-COVID complications. Doctors brushed it off or blamed sleep apnea. Eventually, she got him into Mayo Clinic. They confirmed early heart failure and that he'd had a missed heart attack earlier that summer. Her pushing saved his life. Then there was me. I'd had strep throat and was told the swelling in my neck was a goiter. Bloodwork said my thyroid wouldn't be an issue until adulthood. When I hit puberty, things got worse: fatigue, hair loss, mood swings, constant illness, brain fog. My mom called me lazy, even pushed for a bipolar diagnosis. Stepmom was furious. She said it was my thyroid and kept pushing. I wasn't taken seriously until I was 19, when I was finally diagnosed with Hashimoto's. She absolutely missed her calling. Story 28. Not a doctor, but big thanks to the one who helped me. My mom had H. pylori years earlier, and I started getting similar symptoms around age 11: nausea, pain, vomiting, fatigue. Doctors told me to stop eating junk food, but even bland food made me feel like my stomach was splitting open. My PE teacher let me sit out with saltines because I was so underweight. I was overseas on a military base, so care was limited. I kept saying I probably had what my mom had, but no one took it seriously. It took 10 years before a stateside military doctor actually reviewed my blood work properly and saw signs of iron deficiency and salt cravings, classic H. pylori symptoms. A barium test showed my stomach lining looked like Swiss cheese. One round of antibiotics fixed it, but the damage was done. My esophageal valve is so weak now that I puke easily and can't eat large meals. Still, I'm grateful that doctor actually cared. I never even got his name, but I'll always remember what he did. Story 29. Not a doctor, but I knew something was wrong. My father-in-law passed out not long after starting a new antibiotic. His wife didn't think it was the meds. She said the urgent care doctor and pharmacy would have caught any dangerous interactions. I asked what the drug was: Cipro. I looked it up and saw it had serious interactions with the heart meds he was taking. I asked her to please tell the ER doctors my theory. Turned out I was right. A cardiologist later called the pharmacy and gave them hell. I used to work in a pharmacy, and drug interactions pop up on the computer when filling scripts. I don't know how they missed it. Maybe they override mild warnings so often that they ignored this serious one. Either way, it could have been fatal. Always check. Story 30. Patient here. I was misdiagnosed for years. I had nausea, urinary issues, trouble swallowing, lightheadedness, weird heat sensitivity, and nerve pain. I saw so many doctors, I lost count. I was told it was all in my head. One even said I was faking. My PCP's assistant accidentally referred me to a Stanford specialist, and I thank her every day for that mistake. After many more tests, I was diagnosed with a rare autoimmune disease called AAG. I was sent to a specialist who confirmed I had the autoimmune variant, which caused my gastroparesis, heat intolerance, fainting spells, and small fiber neuropathy. Fewer than 200 people a year are diagnosed with this condition, and only half of those have the autoimmune type. I'm just lucky we caught it when we did. I still can't believe a scheduling mistake finally led me to the answer I'd been searching for. Story 31. I'm a patient. A year ago, I found out I was pregnant again, just 9 months postpartum from our first baby. My husband and I were thrilled, but I had this strange feeling that something was wrong. I didn't have a reason, it was just a gut instinct. I even told him I didn't think it would be as easy this time around. He was kind of annoyed I wasn't more excited, but admitted he was nervous too. A few weeks later, right before my first OB visit, I was driving home and couldn't stop thinking, "You're going to be one of those women who miscarry." I said a quiet prayer, asking the universe that if the baby was sick, to take it now rather than later. I pictured this little boy weak and unwell, and felt an intense sadness. 20 minutes later, I got home, said hi to my husband, and immediately began bleeding. At the OB visit, it was confirmed, I'd miscarried. But now, as I hold my healthy 6-week-old baby boy, I know intuition is powerful. And real. Story 32. I slipped on some cardboard at home. Not a hard fall, just landed sitting down. Seemed harmless. But in the days that followed, I started having ankle and foot pain that felt more like bone than muscle. I assumed I'd fractured something small. I went to a walk-in clinic. They dismissed it as a light sprain. The doctor gave me a compression sock and said to keep moving. That sock hurt so much I cried while wearing it. A few days later, I went to the ER, got an X-ray. They only scanned one position. Still nothing. They told me to try a looser sock. The pain worsened. I went to urgent care again, brushed off. Went back to the walk-in for a second opinion. The nurse outright refused to examine me, and even wrote in my chart that I was convinced I had a fracture. I paid out of pocket for a private MRI. It showed an acute heel bone fracture. The NHS said it didn't show on X-ray because they didn't position it right. I just needed someone to listen. Story 33. About 4 years ago, I started having severe digestive problems. Every time I ate, I'd either throw up or urgently need the bathroom. My primary care doctor thought it was just a bug and gave me nausea meds. After a few weeks, I saw a GI specialist. 2 months passed, I'd lost 40 pounds, had no energy, constant pain, and could only eat a few bites at a time. The GI ran several tests and said I just had IBS. I kept asking if it could be my gallbladder. I had all the symptoms. One night, I woke up with chest pressure, couldn't move my left arm, and was rushed to the ER. They monitored me for heart issues. Nothing came up. I mentioned my stomach issues and gallbladder again. Still brushed off. Finally, a different primary doctor took over and referred me to a surgeon. After surgery, the surgeon said my gallbladder was so inflamed he couldn't believe it hadn't been caught earlier. He said it didn't even show up on imaging. Gallbladder attacks mimic heart attacks. Glad I kept insisting. Story 34. A year and a half after my gallbladder removal, I began having similar pain again. Sharp, intense pain in the same area with vomiting. I went to the ER. They ran tests but found nothing, so they sent me home. 2 days later, I went back. The symptoms were worse. I couldn't leave my bathroom for long. They did the same tests, same results. I went to my nurse practitioner, now jaundiced. I asked, did they even remove my gallbladder? He laughed and said whites vary between people and called me paranoid. He diagnosed an ulcer and sent me off. Ulcer meds didn't help, and after 2 more weeks of pain, I was back in the ER. I was nearly septic. Finally, they did an ultrasound and found a bile duct stone, half right. My gallbladder was gone, but the duct was blocked. I needed a stent and 3 days of 4 antibiotics. Then I was finally sent home and started to feel human again. Story 35. When I was 17, I told my doctor I thought I might be autistic. She referred me to a mental health link worker who does brief screenings. He told me I couldn't be autistic because I had a job and a partner. That was that. I went years feeling broken, not different. I ended up working at a nursery, and the autistic kids all gravitated toward me. My manager encouraged me to get formal training. The more courses I did, the more I realized my instincts had been correct. 5 years after my first appointment, I met with the same link worker again. This time, I came armed with knowledge and terms. He seemed annoyed but finally gave me the questionnaire he should have done the first time. 10 minutes later, he tallied the results and referred me to the autism team. I'm still furious it took 5 years, and me becoming a near expert just to be heard. No one should have to become a specialist to be diagnosed properly. Story 36. I tore the short head of my biceps while gently lowering my 40-pound puppy down by the arms. Instant sharp pain that eased a bit with time. Based on 20 years working in a PT clinic, I did a quick self-diagnosis and figured it was a partial tear near the radial head. On Monday, I stopped by the PT department and had one of the therapists take a look. I told him my theory. He looked skeptical but did his exam and said, "Actually, I think you're right." He referred me to ortho. The urgent care ortho dismissed it but ordered an MRI just in case. Report said, small fragment hanging on, technically still attached, but considered a complete rupture. The surgeon later said, "It can't be fully torn, you have too much strength and movement." But it was barely hanging on. They said, "This usually happens to weightlifters in their 40s. Nope, just a 60-year-old woman who overextended her elbow. I was right the whole time. Story 37. Patient here. For 15 years, I struggled with fatigue, skin and hair issues, weight problems, and brain fog. I asked my old NP to test my thyroid because I was eating only 1,200 calories and still gaining. She told me to stop lying about my food and try harder. I got the same answer from every doctor I saw. My current doctor at least ran thyroid panels, but they were always borderline normal. Eventually, I saw an ENT for something unrelated. He said my thyroid was visibly enlarged. That started more scans and a biopsy. Result? Thyroid cancer caused by long-ignored Hashimoto's. Hashimoto's is an autoimmune disease that causes swings between hyper and hypothyroidism and leads to nodules, some of which turn into cancer. Every symptom I had was tied to it. I wish I could give a huge F you to my old NP. Also, stop telling women their issues are due to laziness or weight. You missed a literal cancer diagnosis, Marge. Story 38. Between June and July, I started getting migraines, 3 or 4 per week. They weren't crippling, so I pushed through. A few weeks later, I noticed my dog licking my forehead constantly, sometimes even trying to paw at my head. I thought it was funny at first. I asked my doctor to run some tests. I was put on a long wait list. He wasn't expecting to find anything. About a month ago, I had a severe migraine that affected my breathing. Our doctors did a CT scan and saw something off. They referred me to a specialty hospital. The MRI revealed a growing brain tumor, right in the area my dog kept sniffing. Just last week, my dog barked at me and bit at my leg to alert me. I was having my first seizure, which the neurologist had warned might happen. I've started treatment. And yes, she's officially being trained now as a medical alert dog. She knew long before anyone else did. Story 39. One day, I broke out in a terrible rash, red skin, nausea, loss of appetite, feverish, and just felt completely off. I said to my mom, "It feels like something toxic is inside me." Doctors said it was likely an allergic reaction to a recent antibiotic. I didn't buy it. Something told me it was worse. My mom supported me, and I ordered blood work on my own. I had a hunch it was liver-related. The results showed liver injury. My enzymes were way up. A follow-up test one day later showed they'd doubled. My liver was crashing, borderline failure. If I had waited like the doctors said, I'd have needed a transplant within days. Turns out the antibiotics had caused drug-induced liver damage. I stopped the meds, and thankfully my liver recovered. But that deep feeling that something was seriously wrong saved me. I'll always listen to that instinct from now on. Story 40. Not quite a self-diagnosis, but Dr. Google helped. One Saturday morning, I suddenly went deaf in my right ear. Not like a temporary muffling, it was completely gone. I Googled it, and everything said to get seen immediately. I called my GP's office on Monday and explained. They brushed it off and gave me an appointment 2 weeks out. When I finally saw the GP, he didn't think it was anything serious. I pushed for an ENT referral. The ENT was shocked, said sudden hearing loss is a medical emergency, and that immediate treatment gives the best odds. A hearing test confirmed the loss, and I was put on a strong course of steroids for several weeks. A second test showed partial hearing recovery, thankfully. No known cause was found, but the audiologist said I was lucky. The patient right before me had the same thing, and never got his hearing back. Moral: don't ever wait on hearing loss. Push hard.